So I have some news coming out of California on the subject of single-payer healthcare. So recently there was a bill that we've seen before, if you've been paying attention, that was drafted and put forth, and it essentially died. And I want to discuss it and give reasons for it. The reasons are fairly obvious, and give word to this situation because it's incredibly relevant. So this is an article from the LA Times that details the following. Lawmakers declined to vote on a high-profile effort to overhaul California's healthcare system on Monday, putting an end to a proposal that would have guaranteed medical coverage to every resident by levying billions in new taxes. Assembly Bill 1400, Assemblyman Ash Calera, a Democrat of San Jose, did not have the necessary votes to move forward ahead of a key deadline Monday. Instead of forcing a vote that could be politically damaging for some of his Democratic colleagues, Colorado opted to let the bill die, angering the California Nurses Association that has championed single-payer healthcare for years. Despite heavy opposition and substantial misinformation from those that stand to profit from our current healthcare system, we were able to ignite a realistic and achievable path towards single-payer and bring AB 1400 to the floor of the Assembly. Colorado said in a statement, however, it became clear that we did not have the votes necessary for passage, and I decided the best course of action is to not put AB 14 for a vote today. AB 14 would have created a publicly financed healthcare system called CalCare that could cost between $314 billion and $391 billion in state and federal funds, according to a legislative analysis. But supporters said residents in the state would ultimately have saved money when compared with paying for insurance, copays, and deductibles. Elected leaders in California had the opportunity to put patients first and set an example for the whole country by passing AB 1400. The California Nurses Association said in a statement. Instead, Assembly member Ash Calera, the main author of the bill, chose not to hold a vote on this bill at all, providing cover for those who would have been forced to go on the record about where they stand on guaranteed health care for all people in California. It's the second time in the last 5 years that a single-payer bill has died in the Assembly. In 2017, a Senate bill to create a single-payer plan was shelved by Assembly Speaker Anthony Rendon, who called that proposal woefully incomplete. Rendon's decision at the time angered the nurses union, which said failing to put it up for a vote was a cowardly act. Now, I want to just single out this guy right here, this guy Rendon here. He's a huge recipient of health insurance money, okay? He's insanely corrupt. And that's essentially what this hinges on. So just to give you a little bit of history. So as I just read there, this isn't the first time California has dealt with this. They just dealt with it in 2017. And also, I didn't know this, but, I did know that Arnold Schwarzenegger, is a former governor of California. He was a Republican governor of California for a period of time at one point in history. But what I didn't know is that he actually vetoed a single-payer healthcare bill back in 2006. So I just awakened some disdain for Mr. Arnold Schwarzenegger. I didn't even know that happened. Okay. But so anyway, this has been going on for quite some time in California. For you guys that know, California is overwhelmingly Democratic. And at the state government level, they actually have Democratic supermajorities. So the fact that something like this can happen when you have Democratic supermajorities tells you what? That's just in name only. We saw when Barack Obama was president, he had Democratic supermajorities. And the best we got was an individual mandate, which was the Heritage Foundation healthcare plan, which is a Republican healthcare plan, which is a huge giveaway to the private insurers. Is it better than nothing? Sure. But it's not what you should receive in, nominally speaking, with Democratic supermajorities. I mean, you didn't even get a public option, let alone Medicare for all. Okay? Now, what was the cause of this failing? Well, first of all, he didn't bring it down for a vote, the guy that essentially crafted the bill. He didn't bring it down for a vote. Well, why? He probably wanted to provide cover to his fellow Democrats that are corrupt, that are taking money from the health insurance companies and all the rest of them that oppose this legislation, the business leaders and what have you. And they wanted to protect themselves. He wanted to protect them because he could have forced the vote on this. Now, it could have very well failed because, as I'll get into, there was a large swath of money that was pushed in when this legislation was brought up once again. And now that it's failed, we have to wait another year, 365 days for this to be brought up again. But it seems like they wanted to, provide cover, because when the people see that Democrats can't even get themselves together to support something like single payer healthcare, okay, I mean, the people will turn on you quick, and they don't want that, of course. So he didn't bring it down for a vote. He didn't force the vote, which is something that he should do, which is a strategy that people like Sinema and Manchin have been exercising ever since Joe Biden got in office, okay, withholding their votes to get what they want in their interests. Now, of course, their interests are corporate interests because they're incredibly corrupt, but it's the same strategy. And these people lack the cojones in order to execute that strategy that other people are using for their own gain. And of course, their gain is diametrically opposed to what the American people want. Now, in regards to this bill failing, we saw a huge amount of money go into this, and it's been happening for years because, like I said, this is an ever so reoccurring thing, specifically with California and them trying to get their own single payer system. So I instantly turned to the Daily Poster for things like this, David Sirota's publication, because they're incredibly amazing at following the money, what I like to call, and what they also call following the money. But this article details the following. There was likely another reason the bill died. Big business had stepped in to quash it. As International Business Times reported at the time since 2012, business groups and healthcare companies on record opposing the measure that we just discussed, had donated more than $1.2 million to the California Democratic Party. $1.2 million. Those same groups had also donated more than $1.5 million to Democratic Assembly members, including $82,000 directly to Rendon, that guy we spoke about in the beginning. Rendon had also received more than $101,000 from pharmaceutical companies and $50,000 from health insurers. These same groups donated more than $2.2 million to the state Democratic Party. Blue Cross Blue Shield, another health insurance company, has also been donating money to these people and to Gavin Newsom himself. And Gavin Newsom, since we're on the subject, he is a spineless, feckless human being. He is. He has no fight. He's insanely corrupt. He doesn't know how to get what he wants. He talks a good game. He hardly talks a good game. I retract that statement. The game that he talks is okay. But, I mean, he has been, quote-unquote, champion single-payer healthcare system for years now, he says. And he's on the record saying that he supports it. But what's he doing? What's he doing? What's he doing on this? Why is he not trying to corral these people in order to bring this down here for a vote, that bill to the floor for a vote, so he can hopefully pass it? You know, one would think that he actually vetoed it, and he might have if it would have gotten to his desk. Who knows? He's a huge recipient of this big pharma money, this health insurance industry money. And the big businesses and the private health insurers and the people that are opposed to this because they stand to profit off the current system, they're spewing endless propaganda, how it'll badly affect the economy and jobs and all that nonsense. The University of Massachusetts Amherst came out with a study years ago that if we implemented a single-payer system at the national level, so the entire country we have single-payer healthcare, we would save, I believe it's like 5.1 or $4.1 trillion. I think it's 5.1. The point is we'd save so much money, trillions of dollars over a decade. Because the way our system works now is we have these private health insurers, there's basically this big middleman, and it's the same thing with the pharmaceutical industry, where you have to go through them in order to get your care, and you pay a lot of money for it, and you may not even eventually need care, but you're still paying money a month, and you have these deductibles, these co-pays, and you got to come out of pocket. And it's this huge ruse, and it's a scam is what it is, and these people that are opposed to it stand to profit from it. That's all that it is. Here's a headline for you. In 2021, 72% of United Health's $222.9 billion health plan revenue came from taxpayers. This is a healthcare company that got an insane majority of their increase in wealth from the taxpayers, directly from me and you. We're making these people rich. We're making these companies rich because our system right now is for profit. Healthcare shouldn't be for profit, okay? It shouldn't be for profit. The way the California bill work, of course, as single payer works is that the government would step in, they'd push the profit gouging middleman out, and they would supply the necessary funds for healthcare. Let me break this down. So we pay taxes here in this country, like in every civil society. Wouldn't you want your tax money going to something like healthcare, like education, like paid family leave, childcare, and other things that you directly benefit from? Because that's not where your taxes go right now. Your taxes go to Wall Street bailouts, endless war, corporate subsidies. That's where your taxes go. Yeah, when you pay taxes now, it goes to Raytheon, Boeing, to a drone strike that'll kill innocent civilians in the Middle East. That's where your tax money goes now. But certain California lawmakers are trying to make it to where your tax money goes to a just place to where everybody has health care. Now, in terms of California and their healthcare system, they actually have achieved near universal coverage, but through private insurers, which is bad. Okay? We don't need it through private. Healthcare shouldn't be something that's private. It's absolutely ridiculous. But just to read you off, I've been rambling for some time now. Just a couple, not going to go through every single one, but just several countries that have implemented this radical idea of universal health care. Australia, Austria, Belgium, Canada, Chile, Denmark, Finland, France, Germany, Greece, Hungary, Iceland, Israel, Italy, Japan, Netherlands, New Zealand, Norway, Poland, Portugal, South Korea, Spain, Sweden, the UK. And every single one of these countries, when you rank them, are ranked above us in terms of their healthcare system, their efficiency, their life expectancy, the money that they save, all the rest of it. Look, man, if you don't understand that by this point we need single payer healthcare, I don't really know what else to say to you. It's so obvious, and it brightens my day to see that the American people understand this, because they really do. No matter how you phrase the question, because some of them have phrased the question in a very, dishonest way. Would you like a government takeover of healthcare? We've seen that in these Fox News polls, and the people still say yes, we do. We want the government to step in and, quote unquote, take over healthcare, because it shouldn't be left up to the private sector. But anyway, this failed in Cali. It's completely unfortunate. The big businesses, the health insurance companies, are at it again. Politicians are incredibly corrupt, even when they're quote unquote Democrats, but hopefully we can see more positivity on these grounds in the very near future.